Good afternoon, everyone. I am Desi Fleming, Director of Fargo Cast Public Health, and will be your moderator for today's meeting. With me today are local health system and local leader representatives. The purpose of this briefing is to make you aware as to the seriousness of our health system's capacity and staffing resources, as well as the physical and emotional demands being placed on our healthcare workers. This not only applies to potential COVID hospitalizations, but to any health issue or injury requiring hospitalization care that will further strain our healthcare resources. We as the public need to do our part and make choices that improve our chances of staying healthy and safe. As for the pandemic, it is not over. We are in our fourth wave, which has been termed predominantly a pandemic of the unvaccinated at this point, especially with hospitalizations, serious illness, and deaths. We need to employ any and all mitigation efforts for a layered approach to prevention to safeguard our healthcare system going forward. Our first speaker today is Dr. Doug Griffin. Dr. Griffin is the Vice President and Medical Officer at Sanford Health in Fargo.
Hello, thank you very much for having me today. I want to make a few points today. First of all, our medical centers continue to have a very high number of patients. Yesterday, we had 545 patients in our hospitals in the morning, which put us at nearly a peak of all time of bed capacity. Of those, 35 were actively being treated for COVID in one of our special care units, and just 10 of those had been admitted yesterday. 9 of the 35 are in the intensive care unit. On top of that, there's another 25 patients out of isolation, but still in the hospital recovering from COVID. And while we've seen great success in a number of things to help our communities, one of them being monoclonal antibody treatments to keep patients out of the hospital, I do want to point that there is very limited supply of that as we enter this fall. The demands for treatment in North Dakota are anticipated to exceed the allocation. So that would be another reason why people should not rely on getting the monoclonal antibody if they become sick, and more reason to do the primary prevention measure of getting vaccinated. At the same time, we're experiencing a historic workforce shortage, not only in nursing, but in other patient care and non-clinical areas. I would like to comment that the shortages are in no way related to our vaccine mandate. We have lost very few staff due to the mandate, yet we could still hire hundreds of staff from nursing to environmental services today if they were available. Nearly 90% of our staff is compliant with the vaccine or has an acceptable exemption for religious or medical reasons, with our deadline still more than a month away on November 1st. We are hiring more traveling nurses, reassigning medical and clinical staff, and encouraging non-clinical staff to help in areas where we have the greatest need. We have increased incentives for both current employees and new hires, as well as bonuses for referring new hires. We have reduced our schedules for non-emergent surgeries by 30%, and will continue to evaluate this on a daily basis. Due to the increased demand for testing, we have also now reopened our drive-through testing garage on South University, available 8 to 5, 7 days a week by appointment. We are now offering booster doses of the COVID-19 vaccine for the moderately to severe immunocompromised people, and very soon for the population the CDC has just identified in the last 24 hours as eligible for boosters of the Pfizer vaccine. We are holding flu and COVID-19 vaccine blitzes at the Fargo Dome and throughout our locations in our region, as well as offering them at our primary and specialty care clinics. And you can find more information about this on our website, sanfordhealth.org. Even with all of our efforts, cases continue to rise. After 18 months, our staff is tired and our resources are limited. Nurses, therapists, and techs are working long overtime hours. Doctors in the hospital are working 3, 4, or more 4-week stretches without days off. This means that not only our staff, beds, and resources is stretched in caring for patients with COVID-19, but also in caring for all the other patients, such as those coming to our hospital for our level 1 trauma services, our stroke and cardiovascular services, or having cancer problems. It is up to each of us to take responsibility and do our part to stop the spread. Please follow the CDC guidelines for wearing face masks in indoor public places, practice good hand hygiene and social distance, get tested at the earliest sign of symptoms, and by all means, please get the COVID-19 and flu vaccine as soon as possible. You're doing it not only for yourselves, but for our community. Sanford will continue to play a leadership role in keeping our community safe. And I just want to close by saying we're so grateful to all our Sanford physicians, nurses, and other staff who continue to work long hours and provide outstanding care to all our patients with kindness and compassion. Thank you very much for the time.
Thank you, Dr. Griffin, for your comments. Next, we have Dr. Rich Better. Dr. Better is the Chief Medical Officer of Essentia Health in Fargo.
Great. Good afternoon, everyone, and thank you for having me and for allowing me this opportunity to provide an update from Essentia Health at how we are doing in regards to caring for our patients and communities with the recent increased volumes in our hospitals, clinics, and emergency departments. Really, for the past several months, we've been at or near capacity at Essentia Health in Fargo. This is due both to increased medical demands of our patients, but also the recent rise in COVID-related illness. And as I mentioned, it's not just our hospitals, it's our emergency rooms, our clinics, our urgent cares. If you've been to any of those facilities, you'll have recognized that there are delays in getting that volume of patients through. This week, we've had the largest number of COVID inpatients that we've had since last fall. In Fargo today, this past week, we've been averaging about 15 to 20 inpatients a day, 4 or 5 of those in the ICU and 3 to 4 of them on ventilators. Over 90% of our inpatients continue to be those that are unvaccinated. We've been holding people in our emergency departments longer than we would like to. We're having to delay transfers in from outlying facilities longer than we'd like to. And this is occurring almost on a daily basis the last week or two. We've been delaying up to 5 to 10 patients per day from those outlying facilities. Our staff, as Dr. Griffin said, have been working a lot of extra hours trying to meet our patient and community demands, but we're concerned with the current pace that they're just going to continue to get more tired and burnt out. So we're really concerned about our staff. In addition to our staff, we know that the staff of our other healthcare facilities are also having similar challenges. For example, long-term care, home health, some of our vendor relationships. All areas are struggling with staffing, and that's putting an increased challenge on getting the throughput from the acute care to the post-acute care. Essentia Health has also been very proud to act as a state transfer center to assist other hospitals in finding placements for patients who don't or can't find placements or can't be accommodated in their usual referral hospital. In September alone, just the past 3 weeks, we've helped place over 130 patients. Some of them have had to be more than several hundred miles from the hospital of their choice. I just wanted to address some vaccine misinformation as well. I know there's a lot out there, social media, the news media, other places. I would just ask that people really look to reputable sources when you're trying to get vaccine information. Some of the things we've been hearing is that the vaccine isn't effective because there's breakthrough with people who've been vaccinated. While that is true that there are breakthrough cases, as I said, the majority of those people don't end up in the hospital and don't end up potentially dying from that disease either. So the vaccines have continued to be particularly effective against the Delta strain in over 90% of cases, preventing hospitalization or death. The other common area that I hear a lot about is around infertility and concerns about fertility. There is no evidence to date that this vaccine affects fertility in any way. That's being looked at. This is probably the most studied vaccine in U.S. history. Hundreds of millions of doses have been given, and there's been no evidence of infertility issue. Pregnancy is the other. We know that pregnant women are at higher incidence for COVID-related complications, just like they are for influenza or other viral-related diseases. And so the CDC, American College of OB/GYN, have both come out and highly recommend that pregnant women consider being vaccinated. There's additional recent evidence, even as recent as this week, showing that newborns continue to have antibodies to help protect them as well. And then maybe finally, I would like people to consider the long-term effects that we're seeing from natural COVID. You might have heard of the term long haul syndrome, people that develop ongoing chronic symptoms related to an acute COVID infection. We know that vaccines reduce the incidence of that. In fact, there's evidence to suggest that even people who have long haul syndrome from a natural infection, if they get vaccinated, some of those symptoms actually resolve. It's estimated up to 10% of people, even 6 months later, will have ongoing fatigue, muscle aches, joint aches, headaches, difficulty with their taste or smell, and just not feeling well. And so again, the vaccines can prevent those long haul symptoms as well. Finally, I'd just like to touch a little bit also on the monoclonal antibodies. As Dr. Griffin mentioned, we're having increasing difficulty accessing that. The Department of Health is going to be allocating that on a case-by-case basis based on utilization, hospital needs, as well as the cases in the community. The state of North Dakota got 400 doses this past week, a little over 400, and we've used all those, and we are not able to meet demands at this point. What can you do? Well, what we're asking you to do, as Dr. Griffin said, is do those CDC recommended hand hygiene, masking, social distancing. Probably the best thing you can do, though, to prevent hospitalization and death is I would strongly encourage you to consider being vaccinated. This will reduce not only your health risks, but the risk to your family, your friends, your communities, and also help ease the burden on our healthcare system. And then finally, make sure that you get the flu vaccine as well. It is safe to get flu vaccine and COVID vaccine together. So if you want to do both of those at one visit, you can do that. At Essentia, we're gearing up that we have vaccine available in all of our clinics, our urgent cares, after hours, weekends. You can go to urgent care and get vaccinated. So thank you for your time. Thank you for supporting us.
Thank you, Dr. Better. We will now hear from Dr. Tracy Newman. Dr. Newman is a local pediatrician and also serves as the health officer for Fargo Cass Public Health.
Thank you, Desi. I think I had some slides, but I can just start. Thank you for the opportunity today to provide an update around pediatrics and what we can expect. You can go to the next slide, please. Nationwide, we've continued to see pediatric COVID-19 cases rise exponentially week to week. Children in the United States now account for a quarter or more of all of our cases. In fact, last week marked the second highest total new cases reported in the United States since the start of the pandemic at 226,000. In North Dakota, cases in children now account for even more, about a third or more of cases. Both new and active cases were ranging anywhere from 30 to 33% being pediatric. And when we look at the new North Dakota 7-day average of childhood COVID case rates per 100,000 population, we're remaining very high, averaging around 76 to 77. Per perspective, a commonly used metric for that considers general population rate of 25 per 100,000 as out of control spread. Next slide, please. Also in North Dakota, we remain to rank very low for our vaccination rate, with 50.6% of our citizens being fully vaccinated, and even lower in our adolescent population. We have 29.8% of 12 to 18-year-olds fully vaccinated. There was just some recent research released last week regarding comparing hospitalization rates and death rates for people that live in the 10 most least vaccinated states, and then people who live in the 10 highest vaccinated states. And what that showed is Hospitalization rates are 3 times higher when you live in the least vaccinated states, and death rates are at least 4 times higher in the least vaccinated states. The good news is we can hopefully expect a COVID-19 vaccine to soon be available for our younger age children, age 5 to 11. Pfizer has announced they hope to seek emergency use authorization for this age range in the coming weeks, as soon as the end of this month. And we're hopeful that the FDA would then authorize that within a shorter time period, maybe by the end of October. It still takes time to allocate these and to get vaccines into children, and it is still a 5-week process before we would see full immunity. So realistically, we're thinking not till later this year or early next year for that population. Next slide, please. A brief just update on what we're seeing here locally for our pediatric hospital capacity. Fortunately, COVID-19 hospitalizations have continued to remain low for children. We've been averaging anywhere from 1 to 3 or 4 every week. We are being quite full, though, on the pediatric side, just because normally this time of year we have expected levels of trauma as well as mental health issues. And one thing of note is it's been a little more difficult placing children once they're in the hospital, because all of our mental health facilities in the area have been quite full. So we're needing to hold them for longer periods. And on top of the normal things we see this time of year, we are experiencing an unseasonably high rate of certain respiratory viruses, in particular RSV. We are seeing hospital capacity and rates we would typically experience in the winter months. And other states who have experienced this, they've seen this last anywhere from 3 to 4 months. We're all sort of braced for the potential influenza surge coming as well. We, of course, did not see that last fall. It is expected we will see those numbers this fall. So some people are worried about what they're calling a potential twindemic, where hospital systems could experience both a surge of influenza and a surge of COVID-19 at the same time. The individual risk for severe illness or death from COVID-19 in pediatric patients does still remain low. However, when we experience higher volumes of cases with surges, you can expect increased hospitalizations. In other states where the Delta variant has already peaked, we have certainly seen them reach and or exceed pediatric hospital capacity very quickly. And local modeling data we use here is predicting our Delta variant could surge in the coming weeks. And of course, this would be prior to any widespread pediatric vaccine availability. Next slide. So again, what are things we can please do to keep our kids safe? If you have a child who's 12 or older, we encourage them to receive the COVID-19 vaccine. We encourage everyone 6 months or older to receive an annual flu vaccine. Please keep children home if they're not feeling well, and we encourage them to be tested for COVID-19. Everyone of the age of 2 or older, we encourage to wear a mask in indoor spaces, especially in schools. Please socially distance when able or have things outside. Wash your hands often. Please continue to practice respiratory etiquette, so coughing or sneezing into your elbow or into a Kleenex, trying to avoid touching your eyes, nose, and mouth. And then when indicated, we really encourage you to follow the isolation and quarantine protocols per the Department of Health. Thank you.
Thank you, Dr. Newman. Next up is Nicole Christensen. Nicole is the Chief Nursing Officer for the West Market of Essentia Health.
Thank you, Desi. Good afternoon. I appreciate the opportunity to share some thoughts. I've been asked to reflect on the impact of our current healthcare situation in our region on our nursing and care teams. My hope is that I'm able to portray an accurate picture of what our nurses and others are experiencing. Nursing has long been a very trusted and honorable profession. The goal of every nurse is to provide exceptional care for the patients and families that we serve. These past 18 months have been taxing on our direct care nursing staff in all areas of care. The thought of being in healthcare during a pandemic is one thing, but the added pressures and complexities have compounded the stress of our nursing and our care teams. Our hospitals are full, not just in Fargo, but across our state and our region. The census and the demands for care are consistently high, with little to no alleviation over this past 18 months. Generally, in acute care, we'll see ebbs and flows in our census, which allows for some natural rest periods for staff. We are not seeing that and have not seen that in the last 18 months. This consistent demand has led to some nurses choosing to leave the profession or not join the profession of nursing at all, or choosing a job within our profession that is less stressful and less demanding. I continue and will forever be proud of the dedication of our direct care nursing staff. Our staffing challenges and workforce demands have been present for quite some time. As Dr. Griffin mentioned, it is not just these past 3 to 4 months. Our staffing challenges in nursing and other care providers has been longstanding, but our need for additional staff right now is definitely related to the amount of patients seeking care and the high census that we're experiencing within our hospitals across our state and our region. I cannot emphasize enough, these are hard jobs with many demands. The complexities of our patients that we are serving have increased, not just from a clinical perspective, but also a social perspective. These demands cause stress on our caregivers providing that care as they continue to strive for high quality care every single day, every single shift. Again, I cannot stress enough the impact that nursing and other professions, such as therapists, respiratory therapists, have had on this pandemic response. But I also want to recognize the impact that this pandemic and the past 18 months have had on our healthcare professions. It is something that we can't overlook, and myself and many others in nursing leadership and leadership across Essentia and many of our other facilities across our region and our state are monitoring and reacting to every single day. But it is challenging, and it's going to continue to be challenging. Thank you.
Thank you, Nicole. Lastly, for our health system representatives is Brittany Sashjiva. Brittany is the Vice President of Operations at Stanford Health in Fargo.
Thanks, Desi. So in addition to my role in operations, I'm also a nurse, and I think that the comments Nicole made were extremely well stated. The pandemic's been with us for 18 months, a little over. It seems like old news to many, but I can tell you that it is very much a hard-fought battle still today at the front lines for our caregivers. They are tired, they're frustrated, they are overworked, they miss their families, and they miss time away from work. We're supporting them the best that we can as leaders through pay incentives, free meals, additional resources, through travel and contracted staff, and trying to support their mental health and well-being. With that said, I couldn't be more proud of them, but it is time for the community to step up and take action. Get your vaccines, please. Our healthcare heroes are counting on you to do your part. I want to make sure and thank all of our healthcare workers at Stanford and across the region, from our physicians, nurses, other clinical staff, to the folks that are working extended hours in environmental services and food services. We appreciate you and all that you've done for our community. And just a final plea to please do your part. Get vaccinated against COVID, get vaccinated against the flu, and utilize practices that will promote health for our larger community. Thank you.
Thanks, Brittany, for your comments. We will now hear from local leaders. First to speak is Fargo Mayor Dr. Tim Mahoney.
When the healthcare systems came to us and talked to us about the statistics and what's happening in the hospitals and becoming overwhelmed, we felt it was a call for action. In our community, we don't usually reach out to the public unless we think there's a serious issue here. Our people are getting overwhelmed. And whenever we have a crisis, a flood or anything, we oftentimes ask the community, what can you do to help out? What you can do to help out is get vaccinated. 90% of the people going to the hospital are non-vaccinated. That helps to decrease the burden to our healthcare system. And the reason I want you to think about this, if your grandfather or mother or somebody has a heart attack or somebody needs acute help in the hospital, if they're overwhelmed, it's hard to them to do the usual things they do for our community. So this would be concerned, an alert. This is a cry for help from our health system. Please, please make our community handle this virus in a good fashion and not overwhelm our nurses, our staff, our people that are taking care of you. Thank you.
Thank you, Mayor Mahoney. Next, we will hear from West Fargo Commission President Bernie Dardis.
Thank you, Desi. Good afternoon. The elected officials are back asking our community to reconsider those that haven't been vaccinated. At the present time, the youth of our community are being affected by this. Dr. Newman just said that 29.8% of ages 12 through 18 have been vaccinated. The important factor is that those 12 and under can't be vaccinated. So tonight when you're at home and reflecting and having a cup of coffee or a beer, or you go to bed tonight, or early in the morning when you're laying in bed and reflecting on what you're going to do for the day, think about this. What are you doing to protect the children that live next door that might mow your grass? What are you doing to protect your grandchildren, my grandchildren, your great-grandchildren? The nurses are fatigued. The healthcare profession is fatigued. We need your help. I respect your choice of whether to get vaccinated or not. But ladies and gentlemen, this is reaching a new level. It's affecting the children in our community. It's time. So with all due respect, we ask your consideration. We ask your reconsideration, and please get vaccinated. Thank you.
Thank you, Commission President Dardis. We will now hear from Moorhead Mayor Shelley Carlson.
Thank you, Desi. As we heard very clearly from our medical providers, this is approaching a level that we all have to step up now. Our medical providers are fatigued, they're tired. Do you want those types of individuals really to be administering care when they haven't maybe been able to go home for 16 hours because they are so overtaxed and overworked and tired? Do you want to have your loved ones waiting in the ER because beds are being taken up by individuals who haven't gotten vaccinated or are now in the hospital with COVID? Do you want children to have to go through this issue, this pandemic problem, like Mayor Dardis was saying, we need to protect our children. I also think it's very important that Dr. Vetter mentioned the myths that need to be debunked in our community. I think that those are some of the biggest concerns that I've heard from people who are not vaccinated, particularly on the side of individuals who are seeking to get pregnant or are pregnant. I can tell you from my own personal experiences with individuals and my family members that there have not been issues that have arisen with those particular concerns. So we are one metro area. Moorhead is just part of this metro area just as much as Fargo, West Fargo, Cass County, as is Clay County. Similar to Mayors Mahoney and Dardis, I ask you please to get vaccinated for our community so that we can eventually someday go back to normal. Thank you.
Thank you, Mayor Carlson. To wrap up, we have Cass County Commission Chairman Chad Peterson.
Thank you, Desi. 9 out of 10 people that have COVID right now in North Dakota are not vaccinated. 9 out of 10 people in the hospital right now are not vaccinated. The one that is in the hospital that is vaccinated has severe underlying health conditions, generally speaking. I know there's a small number of people out there, be you youth or be you medical, have medical reasons or religious reasons that cannot get vaccinated. The reasons we're having this meeting right now is to encourage those of you that aren't to get vaccinated so that we have room for those people should they get ill. I realize there's a number of us out there that will never, no matter what I say, local, federal, state leaders, local, federal, state medical advisors and professionals will never get this vaccine. I've not given up on you yet. I think you're smart enough to realize what's happening. I'm appealing to you directly to put Facebook down and Instagram and Twitter, and again, look at the numbers. I know you think you're going to be fine if you get COVID, and chances are you will be fine if you get COVID. I'm not worried about you. I've never been worried about you. Your wife, your husband, your kids, you'll all be healthy and fine and move on. I'm worried about the 10 people, that's a real number by the way, the 10 people you're going to give it to before you realize that you're even sick. Those are the people I'm concerned about. Yes, you'll be fine, but will they? And for the remaining people that haven't gotten vaccinated, those that are too busy, those that are distracted, those that have other things to do, or maybe you're scared. I appeal to you as well. Get vaccinated. The odds it's going to hurt you as bad as you think it is 0 to none. You're going to be safe. You're going to be better. Exponentially so when compared to if you do nothing. And again, whether you're going to be fine is irrelevant. It's whether your neighbors will be fine. Whether your neighbors' children, parents, grandparents, brothers, and sisters will be fine. Because maybe they won't. Get vaccinated. Thank you.
Thank you, Commissioner Peterson. And again, thanks to all of our speakers today and your dedication to continue providing healthcare and leadership in this community. I want to also express my gratitude to the healthcare workers for their resilience and perseverance. I admit that lately it's hard to find words anymore when our messaging, our efforts seem tainted by misinformation, criticism, and apathy by many. Today I see as a call to action from what we've heard from our health systems. Get vaccinated for COVID. Monoclonal antibody treatment to prevent serious illness may be limited or unavailable. Get your influenza vaccine. Avoid large gatherings indoors and wear masks in indoor spaces. Stay home if you aren't feeling well. Practice healthy lifestyle choices and seek care early if you are ill. For the sake of your health, your neighbor's health, and our community's health, please do your part. Thank you again for joining us today and stay safe.